This is my sister Lena and my mom Aretha Gray, and they're my audience today. Alzheimer's disease affects about 4 million people in the United States. Unless a prevention or cure is found, 14 million Americans will have Alzheimer's disease by the year 2050. At least one of you have an elder family member that may have signs and symptoms of delirium or dementia, which may lead to Alzheimer's disease. It is important that we seek professional medical help for these family members. For my research, I use Kosher and Herbs, Fundamentals of Nursing, 8th edition, 2008, pages 993 to 994, and Person's Comprehensive Medical Assistant, 2007, page 415. Dementia is a form of chronic confusion. It is a progressive loss of cognitive function. The most common type of dementia is Alzheimer's disease. Alzheimer's disease is a progressive degenerative disease characterized by loss of memory and other cognitive functions. It affects the parts of the brain that control thought, memory, and language. The most prominent symptoms are cognitive dysfunctions, judgment, orientation, and language skills. These symptoms are progressive and exhibit a steady decline, lasting anywhere between 7 and 15 years, and it ends in death. There is no cure or specific treatment for Alzheimer's disease. There are certain medications that may slow the disease down and try to improve the memory. Delirium is often called acute confusion. It has an abrupt onset and a cause which, when treated, reverses the confusion. It is marked by an acute fluctuating change in mental status that is temporary and may be only lasting a couple of hours to a couple of days, and it worsens at night. It can be caused by different types of infections, environmental changes, stress, sleep deprivation, and dehydration. It is often difficult to differentiate between the two conditions, but it's important to treat the causes of them, if possible. If we treat the causes of them, we will be able to reverse the condition. Acute confusion is often delirium, while chronic confusion is often dementia. Clients who are confused often know something is wrong with them and they really need help. Any questions?
I have a question.
Yes.
Do Alzheimer's, do it only affect old people or just younger people, old people?
It mainly affects the older generation because it's a chronic progressive disease. It takes like years for symptoms to turn into Alzheimer's. So mainly the elder population.
Oh, and I was also wondering, what do you mean by acute and chronic?
Acute means the disease happens rapidly onset, like there isn't a warning, you just automatically have confusion and don't know where you are. and it happens soon and it's over with soon. Chronic means it's a slow progression of disease over time. And it can take years and it does not go away.
What do you do if you have a family member that has some of these symptoms?
Like, do you take them to a nursing home?
If you have a family member with these symptoms, you take them to the doctor's office, and from there, your doctor will make a diagnosis and let you know what it is they may or may not have, and they'll get you steps to further where you need to go from there. They're normally like home care, so many of the patients want to stay at home, but oftentimes they have nursing homes that have dementia and Alzheimer's clinic where they help their patient with the specific cognitive function needs. Yes.
So I heard on the radio one day that they got little brain booster pills to help boost your memory. Can that help Alzheimer's patients? Or?
Yeah, it helps. It just really helps boost their memory. But as far as the disease process, it does not go away because there's no treatment. The medicine will just help their memory for short term. Thank you.